Hi, so I'm here with Charles Shepard, the medical advisor, scientific advisor to the ME Association in England, and we're here to discuss the government's new plan that was just released, delivery plan for ME/CFS. And so, Charles, thanks for this.
Well,
The plan has gotten generally negative reviews, and some of them quite scathingly negative, and some sort of, well, it has a couple of good things and in its sentiment, but it really doesn't deliver much. And
yeah,
so, where do you fall in that range of response?
yeah, David. I mean, as you say, overall, I think the reaction from the patient community at least has been disappointing, and some people I think have feel very disappointed by it. I mean, my view is that it has some positive aspects to it, but they are relatively low level, low cost initiatives, which very few people can complain about. But it's a bit like a sort of wish list of things that they would like to see done.
Mhm.
The wording is there, but a lot of it is rhetoric. When it comes to actual hard actions, especially on, I think, the two key areas where we want to make some progress, the report plan, as it were, has failed. So I feel very disappointed in that respect. And these two key aspects of it are one, in relation to clinical care and management of people with ME/CFS.
Right.
And this plan followed on Sajid Javid, who was the Minister of Health, Secretary of State for Health, back in 2022. The plan followed on from publication of the new NICE guideline in 2021,
Right.
which I helped to write. And that resulted in quite a major change in the way that it was recommended that people with ME/CFS here in the UK should be diagnosed and managed. And it was largely welcomed by the patient community, and it was a good document. But Sajid Javid, Secretary of State for Health, recognised that, and this was from personal experience of a member of his family who'd not been managed well,
Hmm.
that things were not going well, and that there was a need for some impetus to get the NICE guideline recommendations implemented. So he set this plan off, and we've been there for 3 years. I think the intention was that this plan would come out after a year.
Hmm.
And there has been enormous consultation with the patient community, the charities,
It seems like so
health.
many hours have been spent in meetings and groupings and
Yeah,
several
exactly.
different.
I've lost count of the number of meetings that I've been to with people, with officials, with ministers, whatever, to discuss this plan. So the consultation process was, if you like, was fine. There was enormous amount of consultation going on when the final draft went out for consultation to anyone who wanted to respond to it in last year. I think there was about 3,000 separate inputs to the plan. So the people who were writing the plan, those of us who were consulted about the plan, didn't write the plan, but
Right.
the officials at the Department of Health and Social Care who actually wrote the plan um, knew exactly what was wrong. They were not short of being told time and time again that we wanted implementation of the NICE guidelines, which meant that there was a strong desire and a need to get training and education to health professionals, both in what we call primary care, general practice, and hospital-based medicine, and in particular people with, as you mentioned, people with severe ME. All these defects in their care were there. And yet we end up with a plan which is not addressing these issues. And in particular, as you mentioned, and Sean O'Neill, who was Maeve's
Right.
father, wrote a very powerful piece in the Times on publication of the plan. Said, "Look, we've got a plan without a plan." Um,
Well, it reminded me a
it's
little bit of during our presidential campaign. President Trump had an idea of a plan for healthcare. It sort of has
yeah,
that kind of feeling. It's like, oh, this will be nice, but there doesn't seem to
yeah.
be much meat to it.
No,
Any.
there isn't the meat on the bone, and in relation to, we get on to research in a minute, but in relation to actually care and management of people with ME. The problem is that we have the recommendations from NICE. We have recommendations on how to diagnose this condition, and then to refer on where a primary care physician requires help with diagnosis or management, refer on to a specialist centre. And we have the skill set there that's supposed to be in place in these specialist centres and what they're supposed to do. But the skill set is just not there. Many of these centres don't even have a physician there, so they can't diagnose ME. I mean, it's crazy to set up a specialist referral service and say you wouldn't set one up for cancer and say, well, we can't diagnose cancer at this service. So this part of it is crazy. The specialist referral centres are not working as they should be. But the problem here is that the people at the top, the Department of Health and Social Care, don't want to say anything. They don't want to be proactive and set down instructions as to what should happen at
But
a local level, because health services in the UK have all been devolved to local level. So they want to leave it to the local people, the local what we call integrated care boards. These are the health commissioners, the people who set up services and fund services, to decide. And if there isn't the impetus there at the local level from the health administrators, then nothing happens. So this requires, one, a drive from the top, and they were not prepared to do that. And secondly, it does require a bit of funding to improve these services, and that wasn't there either. So
one question about
we're left with a vacuum.
one question about that
Hmm.
that I have is that I mean it seems a lot of the difficulty or the challenge in implementing the NICE guidelines fully is the opposition to them from some of the royal colleges, the very vocal and still active, and
Hmm.
it seems to be that I don't know how one would address that in a plan like this, but any plan that doesn't sort of tackle the resistance to the NICE guidelines seems to be doomed to failure because if there's not
Yeah, yeah.
don't
I
want to
mean,
set up a service with
again, the
people
people who
who
were writing the plan were made fully aware of this fact that there is this um, still this opposition within a certain section of the medical profession, and influential people within the medical profession in this area who didn't like the NICE guideline, who didn't like the removal of graded exercise therapy, who still wanted to have cognitive behavior therapy as a dominant form of treatment for this disease. And so that part of that opposition is not really being addressed. I mean, again, we have some nice wordy statements about the Royal Colleges producing training and making use of the learning modules that are in the plan and have actually been produced. But unless the will is there at the top of the Royal Colleges and the people who advise the Royal Colleges, and you may recall the meetings that we had in the final stages of the NICE guideline with some very powerful voices coming along to still try and ditch the NICE guideline.
right.
And unless we can change those minds as well, we're not going to make this progress.
Right. Okay, so that's in the sort of area of provision of care, and I think you also pointed out that because of the system, it's not there really isn't national provision. It's just very spotty. If you happen to live here, you might get something. If you happen
Yeah,
to live
it's
here,
it's what we call a postcode lottery. And let me just add I hate to bring in negatives all the time, but let me add a couple of more negatives to the plan, because it covers education and attitudes. It
right,
covers basically living with ME and trying to make life better for people with ME, and then research. But two of the other things that went wrong with the plan was the lack of engagement. I mean, I say there was enormous engagement with the civil servants at the Department of Health, but there was a severe lack of engagement with people at the Department of Work and Pensions. This is the part of the establishment that deals with benefits.
mhm,
And equally, there was a total lack of, I think, interest or engagement with the Department of Education, because an important part of the plan was to address the fact that children, and I'm sure you're aware of this, children and adolescents
oh, you mean
with
educate, not medical
ME
education, you're talking this part,
are
education.
often very neglected. And an important part of the management of children with ME is their educational provision.
Right.
And so we didn't get this. Just didn't get this engagement. And Susie from the Times Trust, must pay credit to her because we would go to these meetings at the Department of Health, and Susie would bang on and on and on about trying to get something done for children, and yet there was no one there from the Department of Education to take this on board.
Hmm.
So again, there's some nice words there about improving situation for children. The other thing, of course, with children is inappropriate childcare proceedings and children being labelled as having factitious, illness, and
Right.
then
I mean, I
ending
think
up
that,
in
and I think,
care, and that is still going on.
and the other thing I think you mentioned is that there doesn't seem to be any in terms of Department for Work and Pensions. I guess I don't know if they're the ones who do the PIP payments, but
Yeah.
it seems to be what's going on in that is not really unrelated to this, and you can't really pretend that reductions of potential reductions of
Mm.
benefits is not
Mm.
happening while you're producing a delivery plan for
Yeah.
MECFS.
Yeah, 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 and the contribution. I don't know whether you've read it, but the contribution from the Department of Work and Pensions in the plan is quite bizarre in a way because it fails to address all the problems that people with this condition have in getting benefits like personal independence payment because they have to battle and battle and battle, and quite often they have to go to appeal to actually get their benefit. And yet, most of the stuff from the DWP in the delivery plan centers on which is the government's mindset at the moment, is getting people off benefits and back to work again,
Right.
which is fine for people who are able to do some sort of work if they have ME. But for the vast majority of people with ME, they're not able to do any form of
Right.
meaningful work.
So it just seems to be coming at that aspect of it from a complete misunderstanding of this is, what's going on the ground.
Yep, yep,
Okay, so I think the last area was research, and we've talked about the delivery of services. We've talked about sort of living with
yep,
ME, and now the last area
yep,
was research, which again seems nice, nicey nice, but there doesn't seem to
yep.
be much behind it.
Yeah, yeah. Well, I think there were three working groups looking at all these different areas. I was a member of the research working group, and we were lucky enough to have on that group some distinguished researchers as well, particularly including Chris Ponting, whom you know, and Stephen Holgate, and representatives from the research funding charities. And we became increasingly, I have to say, frustrated by the fact that, again, we were getting a lot of nice words, but no real action
Mhm.
in setting up a really ambitious research strategy. And I have to say, a well-funded research strategy for this condition. I mean, we've got 400,000 people at least with MECFS here in the UK.
Mhm.
We've got 2 million people with long COVID, a million of whom have got some degree of an MECFS component to it. This is a public health crisis, and yet we can't even find any money to produce a really ambitious research strategy. What I kept arguing for was we need something like what was set up for dementia. It's called the Dementias Platform. It was set up by David Cameron when he was Prime Minister. And he found the money for that. I think it was about £100 million. And that's revolutionized research into dementia. Motor neuron disease recently got £50 million
Mhm.
in 2019 for research. So unless you can have some money to actually drive up a research strategy that involves setting up a center of excellence, a hub of excellence, something like dementia platforms, we're just not going to move this forward. Again, the research community made it very clear about all the failings at the moment, the lack of interest, the lack of trust in the processes that go on at the MRC and NIHR, the lack of capacity. All these problems were well advertised to them. And we put forward our solutions, but I'm afraid when it comes to our solutions, they were not really accepted. Okay, we've got a scoping review of what research is there. We're going to have a conference of experts into post-viral disease. There's going to be a little bit of money set aside for repurposing of clinical drugs which may be helpful in MECFS and long COVID. The overlap with long COVID is recognised. And there's they brought in the fact that couple of new initiatives. One's called Prime, one's called Heritage,
Right, but they
which
actually
is
didn't
looking
really
at
deal.
cost effectiveness. But it's not really what's really going to get things moving.
Well, besides which, I mean, there. I just want to make the point. You mentioned the MRC is Medical Research Council, and NIHR is the National Institute for Health Research, and they
Yeah,
jointly kind of fund a lot of the medical research, government funded in the UK. So I just
yeah.
want to clarify that.
Yeah, yeah,
Um,
yeah, yeah. And their record to date is very, very poor, with the exception of the I can't remember exactly how much money went into Decode,
I
the
think it
big
was three,
genetic study
350
up at
million. I think it was
yeah, 3 points,
350 million
something
pounds.
like that. Yeah, I mean that was a big grant which went to Chris Ponting.
Right.
But otherwise, all the research funding, the biomedical research funding in the UK, it comes from the charities. We fund the ME Biobank, costs us £80,000 a year. We fund post-mortem research. Um, ME Research UK do a sterling job here, but it shouldn't be just left to the charity sector to do all this biomedical
Do you think, I mean, at some point in the not too distant future, we'll get the results from Decode ME. Do you anticipate or hope that that will spur something on top of this, that that will be an incentive or create an incentive or create
I I
momentum?
think I mean decode obviously gets a mention in the report, and I mean certainly we're all looking forward to seeing some results from decode. I think there may be some results coming out later in the year, and I mean certainly if there's interesting stuff there being identified, which gives us some clues as to where we go now with research into both cause and treatments. I think we've got to get some high quality researchers putting in really high quality research applications to both
Hmm.
MRC and IHR. And they're under a lot of political pressure to do something.
Hmm. Do you,
So I think let's I'm quite sure whether we're going to end shortly, but I say let's end with a positive note there.
okay, well, so do you, I mean, do you have, now that this is out and people have been waiting for it, and as I said, we'll have the Decode ME results out at some point in the not too distant future or later this year. What happens next? Like, what's next with this plan?
Yeah,
What,
that's very important because I'm at the moment I'm not absolutely sure because we haven't had a meeting with the department or anyone, a sort of post-mortem meeting. I mean, as I was actually having a discussion with some of our charity colleagues about this afternoon. I think one of the things we now need to do is to have a meeting with the civil servants and say, look, we want some sort of mechanism whereby we can follow up what recommendations there are in this report, and the actions. If you go to the back of it, there's a lot of specific actions. Let's see if these actions are actually being undertaken.
Mhm.
So we want some sort of active monitoring of what has been promised. That's there, as I say, it's far from adequate, but there are things that are being promised. The department is supposed to be running sort of some sort of an awareness campaign
Mhm.
about MECFS. So the social services are supposed to be informing their people about, social care for people
Mhm.
with MECFS at the severe end of the spectrum. There is supposed to be something, some group looking at some sort of care pathway for people with severe ME.
Right,
I think the word in the plan is they're going to explore. So we want to know what all these actions are doing.
right. Okay.
Mm.
Well, thanks, Charles. I appreciate your thoughts.
Well, can I say thank you for doing this because your blogs and podcasts and everything else are very powerful and people listen to them.
Well, thank you. I
And I
appreciate
think
that.
this plays an important role in getting things moving. And this is, as you say, this is not the end of it. It's the start of yet another journey in this disease. It's a rather disappointing start, but I'm one of these people who will engage with anyone who's trying to do something to help people with ME, CFS, even though I'm not always happy about the actual way in which it's being done. I
Well,
don't believe walking. I don't believe in walking away from these initiatives.
Okay, well, thanks, Charles. You've
Yeah.
been doing that a long
Mm.
time, so it sounds you'll keep on doing it. Okay, thanks a lot.
Yeah, yeah, yeah. Great.